Today is Rolf session 7, and today is the last session of the core series. For Rolf session 4, we started with the inner heels to the pubic symphysis. Session 5 was working the abdominal area and psoas area. Rolf session 6 was working on the posterior chain of the body to the lower back, and now we're progressing up into the arms, the chest, the shoulders, and the neck muscles. So we have our client, Devo. And Devo, I just wanted to ask you, after Rolf session 6, where you were mostly in a prone position, and I was working on the bottom of your feet and in your calf muscles and hamstrings and gluteal muscles, how did you feel afterwards, and how are you feeling today?
I remember feeling very loose afterwards, kind of walking almost a little funny because I was a little looser than I was used to being. And then the following days we did a lot of leg work in my workouts, and I felt I guess it would be like more efficient motion, like I was able to do more better and not get winded as quickly.
Okay.
So I noticed that as a significant difference because leg days are tough.
All right, thank you for the feedback. And we are going to begin, and I'm going to have Debo in a couple of seconds to slowly come off the table. We're going to look at her structure, and then we will proceed where we will be working 95% of the time with you on your back or on your side, and I'll be primarily working from the shoulders up to the top of your cranium. So before we start walking, I'm going to be looking at Debo's shoulders and to see how they are swinging. Hopefully they'll be swinging in a nice contralateral position. I'm looking at the position of her head as it relates to her spine, and she's going to walk twice to the front door and back. Here we go. Good, and you're going to walk one more time. And as Debo is walking, I like the motion in her shoulders, and I also like how when she's walking, the head is not bobbling from one side to the other. So those are really good signs. So I'm going to make a decision which side I'm going to work with first. And I'm going to work on your left side first. So you're going to lay on your right side, and I'm going to place this pillow in between your legs.
Okay.
So now Debo is laying on her right side, and I'd like to first start with the attachments of the levator scapula, as you know, starting at her occiput and ending at the upper point of her medial border of her scapula. And my goal here is just to relax the attachments at the occiput and also at the medial border. So there's a little bit more movement in the head. And as always, Debo will tell me if there's too much pressure or too little pressure. So just give me a couple strokes, nice medium pressure strokes to the back of her head. So I'm going to ask you, Debo, is there more tightness as I approach your scapula right in this direction, or is there more tightness at your occiput?
In the scapula.
Okay, thank you for telling me. So I'm going to sit down and hydrate the fascia and also work a little bit with the rhomboid. with movement. Going back to the occiput. One of my goals in Sightline is to see if I can increase the space between the occiput and the shoulder. I call it the two-hand test or two-fist test. One thing I like about Debel's fascia is that it's easily accessible, it's not tight, doesn't feel hard, and I feel very few fascial adhesions or any trigger points.
Where do you get to my right side?
Wait until I get to your right side. Okay.
Yeah.
Good. So now I'm going to sit back down and I'm going to work with the area around Debel's left sternocleidomastoid. And as we know, that starts right below the jaw and goes to the sternum and partially to the clavicle. I also like to work right above and below the clavicle. As you know by now, wherever there are bones, there is connective tissue or fascia. I'm palpating for Debel's sternocleidomastoid. Now working a little bit lateral to the sternocleidomastoid. Going back to the occiput. And back to the upper part of the medial border of the scapula. Have you place your left hand on your chest. I want to just do some brief work on the infraspinatus muscle, and I want you to slowly extend your hand to the mirror and back just 3 times. Good, that's a great speed. 2 more times. Thank you. I'll take your hand. Going back to the rhomboids. Going back to the SCM, the sternocleidomastoid, and then we're going to have Devil to slowly come back off the table. Okay, Devil is going to, in a couple of breaths, slowly come off the table. And at that point in time, we're going to ask her to turn her head to the left and right, chin up and down, and see how the left side of her neck and shoulders are doing. So Devil is off the table, and I'm going to ask Devil to slowly walk to the door and back a couple times. And while walking, I want you to turn your head to the left and to the right and tell me how each side feels. Good. And we're going to walk one more time. And then you can share with us your thoughts and how you're feeling. All right.
Well,
thank you.
besides getting a little bit dizzy from turning my head left and right while I was walking, my right side, I could kind of feel it pulling a little bit here as I turn, and my left side, I don't feel any pull. I do feel the muscle working here,
Okay.
but I don't feel any pull, so that's nice.
All right. All right. So good. We're going to have you back on the table. And now this time you're going to lay on your left side. And I get to work on your right side. Okay, Devil is now laying on her left side. And as she mentioned earlier this session, this is where the tightness is. So I tend to spend a little bit more time on the side that needs more work last. So we're going to begin just gently trying to hydrate the connective tissue by the occiput and then by the upper part of the medial border of the scapula. And already after my first pass, I feel more tightness on your right occiput.
Me too.
So after the first pass, double confirmed what I palpated, what I felt was that the attachment of the levator scapula in the right part of her occiput is tighter than the left side. So we'll do a couple more strokes. And last time. Okay, now I'm going to work on the upper traps in the direction of the upper part of the medial border of the scapula. Again, my 2-fist test, and you pass double. This is very good. What I'm also trying to do is to give you more length between the occiput and the upper trapezius muscles. The longer your levator scapula, the longer the muscles that connect from your head to your shoulder, the less constriction, the less compression, the less pain. So now I'm going to work on the distal attachment right on top of the medial border. We're going to encourage some movement and then work a little bit underneath Devil's medial border of the scapula. So Devil, would you say it's tighter on your right occiput or just tighter where my thumb is at the attachment?
Oh God, that's hard because I think it's here.
Okay. So that's the distal attachment, and here is the proximal attachment, right by the occiput.
Yeah, it's the first one. Although right in that spot, it feels pretty tight on this one too.
Okay.
But I think there's more. I think there's more tightness here.
Is there also pain here or just tightness?
Just tightness. What you're doing feels amazing. It doesn't hurt at all, and it feels like it's like really working stuff out.
Many of us will, when we're doing a jumping jack or raising our hand up from the side, we will overly use the upper trapezius muscles. And what I'm doing with the palm of my hand is putting it right on top of Debel's right shoulder and almost like preventing her from using that muscle, those upper trapezius muscles, and use more of the muscles, the middle trapezius muscle, as well as the rhomboids, lifting her shoulder to about right here. Just a couple more times. Good. You're going to place your hand by your right chest. Now I want you to extend to right in front of you. And we're going to do this 3 times. Here we go. Excellent. Right on the infraspinatus. Good. 2 more times. And last time. Good. And place your hand back here. Going back to the occiput. Feels a little softer now compared to about 5 minutes ago. How would you agree with that,
Yeah,
Debo?
it feels a lot more similar to the left side now. A little bit.
A little bit tighter as we go towards the middle of your head.
Yeah.
Okay. So I'm working from the side, from close to the ear, and just going in a downward vector, which means going to right by the spine. And last time. Okay, so now I'm going to work on the sternocleidomastoid, some of the scalenes. We're going to work on top of the clavicle, starting at the sternum, and just gently going underneath the bone, underneath the clavicle, giving that connective tissue a little bit more hydration before we work on the sternocleidomastoid. Any soreness or tightness here, Devil?
Just a little bit, but it's not so bad.
Okay.
It's similar to the left side.
Just a couple more times. Going back to the attachments of the levator scapula to the occiput and the medial border of the scapula. This is the first time in a couple of sessions where I'm now starting to feel a softness in the occiput. Again, working the clavicle. After a couple more strokes working on the occiput, we're going to have Debo to slowly come up from the table. And this time, we're going to have her to walk like we did last time. But I don't want to make you dizzy, Debo, so you don't have to turn your head from the left to the right as we're walking. Okay, we're going to lower the table and have Debo to come off in a couple of seconds. Okay, so Debo's going to walk, and this time you can turn your head. Okay, just very gently. Let's have you just walk up a couple times to the door. Good. And last time you don't have to turn your head. Just, I'm looking at Debo's shoulders, looking at the contralateral motion. Good. So I like what I see. I like the motion in the shoulders. I like how the neck is straight. It looks like it's pretty close to being on top of the spine.
There was no pulling when I turned to the right.
That was my next question. Okay, so this is really good to know.
Yeah.
Now we're going to do some work on your back of your head, and so I can really start to work on more of the muscles in front of the neck as well as the side. So I'm going to have you to slowly come back down, and I want you to rest your head. So we have Debo on her back. There's no cushion to support her head, and I'm putting her in a neutral position. And what I like is that her neck does not want to go to the right side or left side. The chin does not want to go to the right or left side. So this is very good. And I'm also looking at how her chin matches up with the sternum, and it's matching up. So I'm very happy. I'm going to be working, before I work on the neck, continuing to do some work on above and below the clavicle muscles. And I'm really trying to find out if one side feels tighter than the other. So far, I don't feel any major tightness. Well, I spoke too soon. There's a little bit more tightness just on, barely, but noticeable difference on the right side, right where my thumb is.
That's where I felt it.
Compared to the left side. I'm also going to look and see what's happening on top of the clavicle again. Going a little bit slower. I'm not finding any noticeable difference on top, but definitely below, starting right here, starting just to the outside of your chin on the right side. Okay. So I'm going to continue working with the occiput And my goal here is just to give a lot of length, even more length to Double's neck. Double, please tell me if there's any tightness or pain as I go and work on the occiput.
There's no pain, but I do feel more tightness on the right side,
Okay.
closer to the neck.
When you say closer
Right there.
to the neck, you mean more towards the occiput or more closer towards your shoulders?
No, closer towards there.
Okay. So I'm right like between C1 and C2.
And up in there.
Okay, right by the occiput. So I'm just going to see how easy it is to take in a neutral position, to take Double's chin and neck to the left, and she's not going to help me, and then to the right. So yes, it is easier taking Double's chin and neck to the right. In order for Double to turn her head to the left, she has to use her right sternocleidomastoid muscle. And this is where I feel a lot of tightness.
Yep.
Right where my fingers are,
Yep.
right on this levator scapula, where it attaches to the occiput.
I feel it too.
So first, what I'm going to do is work on the side that doesn't need as much attention. I'm going to have Double to gently turn her head to the right. You can see the really good flexibility. I'm going to work and give Double even more length on the left side. So from this side, it gives us a nice position to work on the sternocleidomastoid, which I will do. Good. We're going to slowly come back to neutral. Test out both sides, especially by the occiput. And already there's still more tightness on the right side. So here we go. We're going to turn your head gently to the left. Good. And already as I place my fingers right by the mastoid, I encounter a little bit more tightness on the right side than on the left side. Just one last time. Thank you. We're going to slowly turn our head back to the middle. Just gently taking devil's head to the right and to the left. Still more tightness, but the ability to move your head, devil, to the left is a little bit better than it was before, but still needs some work. Excellent. So we're going to gently turn your head to the left, right there. And I'm going to just take my fingertips, start it close to the attachment of the levator scapula, and just slowly give more length to the right side of devil's right side. Again, taking devil's head to the right and to the left. So I think I've identified exactly the spot, devil, that we need work. Is it tighter in this position here, devil? I feel like an optometrist. Number one, or number two, or about equal?
I think it's about equal.
Okay. And just doing a couple more strokes just to give even more length, starting close to C7 vertebrae and just going just lateral to the spine, all the way to the occiput. Now I'm going to work on the front part of the neck by the vocal cord. So I'm going to be very gentle, very careful. So I feel it's a little bit easier to take devil's chin to the left compared to the right. And there's also more tightness right by the mastoid.
Yep, I feel that too.
So this is where the beginning of the sternocleidomastoid is. So I can trace it by starting at the chin and going underneath the chin on the right side till we get to about right here. And there should be a little bit of discomfort here. So you see what I'm trying to do is to really lengthen this side, and we do that by taking devil's head to the left. If we take it to the right, we actually shorten that muscle. So we are trying to give the most extension. What we can also do to encourage movement is to have devil to open your mouth very wide twice. Ah, good. And this is a great exercise to set up working intra-oral, which will be in a couple of minutes. Good. Come on back. And last time. And relax. And we're going to compare that now with the left side. So we're going to lengthen the left SCM. And I'm going to have Devil open her mouth and tell us if there's any difference between the left side
Oh, yeah.
and the right side. And after we finish this last pass, Devil's going to tell us the main difference. Good. What did you experience on the right side compared to the left side, Devil?
Definitely tighter on the right side. I could feel you more. I mean, I could feel like more, I don't want to say discomfort, but definitely more tension on the right side
Okay.
when you were doing it. On the left side, it just felt mostly smooth. There was only a little bit of tension at the very end.
Okay. So just to sum it up, I feel more tightness right where my fingers are, right by the occiput on the right side, and also more tightness right at the mastoid, right here. So what I'm doing is gently taking Devil's head to the left to try to get more extension, more length. And as we get to the jaw, we open our mouth and come back. So when I do intra-oral work, I'm expecting the right side to be a little bit tighter. And in a couple seconds, a couple breaths, we're going to have Devil to slowly come up from the table, and we're going to work inside the mouth and then the nose, and then we will conclude in about 10 minutes. So we have worked on Devil's cervical vertebrae, fascia. We've worked on the front side of her neck, the scalenes, the sternocleidomastoid underneath the jaw, the mastoid. And I'd like to have to Devil just gently turn her head to the right and left, up and down, and tell me if there are any sources of tightness or pain as you're moving your head. You can also take your chin up and back down.
Okay. So, interestingly, when I turn this way and this way, I feel something down in here.
Let's have you face the camera. So right in here.
Yeah.
Okay, so this right here is the attachment of the levator scapula,
Yeah.
distal, and that is proximal. And I'm going to palpate that right now.
Want me to keep turning?
Nope, you're fine. That's a good question. So here,
It feels.
yes, the left side does feel a little tighter. So
Just in that spot, though, right?
just in that spot. So what we're going to do is a nice exercise for you at home who might have tight levator scapula muscles. You're going to turn or tilt your head to the right, and then we're going to rotate, and then we're going to look down, and I want your hand here, and I want you to gently pull that left hand, fingers to your left wrist. And what I'm going to do is just to very gently go in a downwards direction, and hopefully you can feel the attachment to the upper part of Devil's medial border of the scapula. And how are you feeling right now?
It feels really good.
Just a couple more times. Excellent. And slowly come out of it. And I'm going to palpate again. And I want you to turn your head again and tell us if that helped at all.
Yes. The first turn, it felt like it hadn't, but then the second and the third after, I don't even feel it anymore.
Okay. Excellent. We're going to now have Devil lay back down on the table, and we're going to work inside the mouth first and then inside the nose. So here we go. Devil has come back on the table, and I'm going to work inside of her mouth. So as you know, wherever there are bones in the body, there's connective tissue, there's fascia. So we know that there are a lot of bones in the feet, 26 bones per foot, and the head is full of bones. So what we're going to do is to work inside the mouth, and I'm going to have Debo to gently open her mouth, and I want her to gently close. And what I'm doing right now is there's a front quadrant and a bottom quadrant. There's a left side and a right side, and there's also an outside and an inside. And all I'm doing right now is just gently massaging the gums. Debo, how are we doing?
It's very bizarre.
It's very bizarre. That's a great answer. And now we're working on the bottom on the right-hand side. Ultimately, my goal, I can physically not do it, but it's to go right in here, right by the ear. Now just do this about 4 or 5 times. And I'm going to slowly come to the other side. And you open your mouth. Good. And I'm now working on the left front side. And then that was the top side. This is now the front left bottom. Just a couple more times. Excellent. Now, that's half of the 8 quadrants. Now we're going to go inside. This is where there might be slight discomfort. Okay, and there might even be a gag reflex, but we will be patient and be mindful of this gag reflex of yours. Okay, so now we're going to work on the upper part of Debo's right top mouth. And what I like to do is I like to have my client to take her left hand, and she's going to just put it right here. And if it's too much, I'm just going to have her to, she's going to just squeeze my palm, and then I know that it's too much. So I'm going to have you to gently bite, or you can bite harder. Good, and relax. And bite hard. And every time she opens up, I go slightly even further down and down here. Just 2 more times. 1, good, and 2. And I'm going to hold it here for about 15 seconds. 5, 4, 3, 2, 1. I'm going to slowly come out. And that's the 5th quadrant of 8. I'm going to have Debo to take a couple of breaths. And then we're going to work on also the right side, but inside and the bottom. So Debo's going to open her mouth. And now this is in the bottom part of the mouth is where there usually is a gag reflex. So I'm going to be very slow, very gentle, and you can wrap your hand, there you go, right around my wrist. So gently bite into my finger and open and close. Good. Open and close. Good. 2 more times. Open. I'm almost there. And close. Nice. Last time. Open and hold it right there for 15 seconds. 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly open. 6th quadrant, 2 more to go. Can you tell the Balance Orlando community what it was like that last pass?
So I thought was gonna gag, but I didn't, and I could really feel like the tension on the area um, that you were connecting with,
Yes.
like on the inside.
Yes.
I could feel it. It was interesting because it's one doesn't normally recognize tension inside their mouth, and suddenly I was very aware of it, and it feels different on that side now.
Okay. So I'm really curious to see what it's like on the right side. So here we go. This is now the 7th quadrant. I'm going to go to Devil's right side, top and inside. Here we go. And you're going to take this hand here and place it. There we go. Very good. And I want you to bite down hard. Good. And open. And bite down. Good. A couple more times. Bite down. 2 more times. Open and bite down. Thank you. Last time. Open and wide. And close. And hold it here for about 15 seconds. 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and slowly open.
Wow, that side was definitely
The right side.
yeah.
You say that side, okay?
This side was the right side was definitely like there was more pressure or more tension and discomfort on this side than when you were doing the left side.
So there's more tension on the right side and inside and
In that upper
in the,
number 7 area.
okay. So right side, inside, up. Okay, so we're going to do the 8th and final quadrant. And thank you so much. And bite down hard, open, and close. Good. A couple more times. Open. Good. Close. Open. Close. Got it. One more time. Open. One more time. I apologize. Open one more time. And here we go. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly open.
Interesting. I felt closer to possible gagging. I mean, I almost did gag a little bit there on the bottom on the right side than I did at all on the left side, and I'm assuming that is probably associated with the excess tension on that side.
Yes. Okay. Good. It is a weird sensation, and I appreciate you letting me work inside your mouth. Another interesting area that we're going to work on, and then we'll conclude, are the nasal passages. So if you have a deviated septum or if you've broken a nose, please share that with us right now.
I have neither.
Okay, that's a good sign. I'm going to put some more gloves on. Typically, I like to use gloves. Sometimes I like to use, I call them little baby condoms that are just for the pinky. But today I decided to wear my gloves instead. We're in Devil's nasal passages. We've just finished working on the 8 quadrants of Devil's inner mouth, and now we're going to work in both nasal passages. You see here that Devil has a nice grip on my wrist, and she's going to basically guide me into her left and right nasal passage. I typically use essential oils like eucalyptus oil, but nothing that's burning. So for all you would-be Rolfing and structural integration practitioners, be very careful what essential oil that you use. We want something to just gently open up the nasal passage, not open and burn it. So what I'm going to do right now is just gently put
How far am I going?
as far as we can go comfortably. And you see my right hand is just gently giving support. And I'm working kind of like on the outside a little bit for the left nasal passage. Now my direction is more inward, more down. And it looks like our limit is about right here. So I'm just going to hold it here for about 20, 30 seconds. Okay, double? Okay. And as I'm here, I'm just making just the slightest of movements to try to go even deeper into the nasal passage. Seven, 6, 5, 4, 3, 2, 1, and slowly come out. So you're probably asking, well, how far did I go inside of Devil's left nasal passage? We went approximately 1 inch. Okay, so now we're going to work on the right side of your nasal passage. And she's just guiding me into the nasal passage. And I'm going slightly out in a downward vector, and then I'm going down and in. And this looks like this is the limit, so we're going to hold it here for about another 30 seconds. And again, I'm going to make some slight micro movements. Good. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and I'm going to slowly come out. Now on the right side, we're also at approximately 1 inch. So that's pretty symmetrical. Most of my clients that I've worked on in my 7 years, typically one finger will go in a little bit more than the other, but this is not unusual. Okay, so thank you for letting me work inside both your mouth and your nose. And we're going to conclude with just some little bit more neck work. And so I want to thank you, Debo, for letting me work and trusting me to work inside your mouth and in your nasal passages. I hope it hasn't been too uncomfortable or too painful.
Weird, but not uncomfortable.
All right. I'm going to conclude this Rolf session 7 just with a cranial hold just for about 30 seconds to a minute. Okay. Okay, so we've now worked inside Devil's mouth, nasal passages. I'm just going to conclude with putting my hands underneath Devil's neck, right by the occiput, and just doing a couple strokes right along, just along the spine, not on the spine, but just lateral to the spine of the vertical cervical vertebrae, and feeling that there still is that tight spot on the right side as there is with the left, and there still is some right tension on your occiput, Devil, but it's gotten a little softer. So what I'm going to ask you to do is I'm going to have you take 4 deep inhales through your nose and exhales through your mouth. And after each exhale, I'm just gently giving a nice length into your neck. So, Debo, again, I want to thank you for this last hour to work with you, especially in your shoulders and in your neck. And I want to wish you a great week.